Unlike glaucoma, which is a pathological condition, cataract is a physiological condition whereby all of us at one stage in our lives will get cataract. The way the eye works is very similar to a camera. Light from the environment is bent by two main structures, the cornea and the lens. The light rays are bent onto the back part of the eye, called the macula, and the information is transmitted to our brains. Hence, the bending or refracting of light is determined by our natural lens. In youth, this is clear, so the light is bent very easily. With time, we form cataract, i.e. clouding of this lens or opacities in that lens. The problem with this is that it scatters light or it changes our prescription, which contributes to the following symptoms that patients start getting with cataracts: cloudy vision, glare of lights, particularly driving at night time, blurry vision, or the glasses prescription changes. Sometimes cataracts can be formed early in life. Either one is born with cataracts, which are called congenital cataracts. These need to be taken out very quickly, otherwise the eye and the brain do not develop in synchrony. Or we can start developing them in our youth, whether that be because of a medical condition or a side effect to medications. There's no medicine we can take to prevent the progression of cataract. The sensible advice would be, well, actually, the UV light from the sun can cause cataract formation. So wear good UV protection, sunglasses in the outside. However, the underlying issue with cataract is the management is surgical. So cataract surgery has evolved immensely since the 1980s, when patients were brought into hospital, had to have general anesthesia and stayed in hospital for 3 or 4 days. Large wound incisions were created, which required multiple sutures and long recovery. The way I do cataract surgery now is on drops alone. So essentially, the eye is completely numb, but it ensures patients recover quicker, meaning that their vision's better quickly, and also they can go back to driving much quicker. The eye doesn't look red after surgery, and indeed, you can't really even tell that surgery's been done. I make a small 2.75mm incision, which is self-sealing, ensuring that we don't need sutures after the surgery in most cases. If you think of a cataract as a peanut M&M held, suspended with these loose zonules, we create a small opening in the top of the peanut shell. We then use a small ultrasound probe to suck out the majority of the chocolate and peanut and place a clear lens in its position. The surgery takes about 10-15 minutes, unless the operation will be complicated for other comorbidities, which obviously we've stratified preoperatively in the consenting room. Cataract surgery is the most commonly done surgery in the world. 99% of people get better vision. However, it still is surgery, and there's human errors as well as accounting for patient difficulties during the surgery. Nationally, consultants have been audited as having 2% posterior capsule rupture rates, which is the benchmark of good surgery. I've audited my results at the John Radcliffe, and my PC rupture rate is 0.5%.